A person walks into a hospital with severe headaches. One doctor says, "Get a CT scan." Another says, "No, this needs an MRI scan." To most people, both machines sound almost identical. Big machines, medical images, expensive bills, strange noises. But underneath that similarity sits one of the most important differences in modern healthcare technology. Because these machines do not see the human body the same way. Not even close. And the choice between CT vs MRI can completely change what doctors discover, how quickly they discover it, and how much it costs the healthcare system trying to keep millions alive. That's the strange world of modern medical imaging. A world where invisible radiation, giant magnets, artificial intelligence, and billion-dollar healthcare industries quietly work together every day while most patients simply wait nervously in hospital hallways. The story begins with a simple problem humanity faced for thousands of years. Doctors could not see inside the human body without surgery, which meant diagnosis often depended on guessing. Pain here, swelling there, maybe this disease, maybe not. Modern medicine changed forever once imaging technology arrived. And the first major revolution came through X-rays. Then eventually something far more advanced emerged. Computed tomography, better known as CT scan. A CT scanner uses X-rays from multiple angles to create detailed cross-sectional images of the body. Think of it like turning the human body into digital slices doctors can examine layer by layer. Which sounds futuristic. Because it still kind of is. The truly fascinating part is speed. Modern CT scans can capture critical images within minutes. In emergencies, strokes, internal bleeding, severe trauma, speed matters more than perfection. Because in emergency medicine, minutes can become the difference between recovery and permanent damage. That's why hospitals worldwide rely heavily on emergency CT scan systems. Fast, efficient, life-saving. But there's a trade-off. CT scans use ionizing radiation. Usually controlled and medically justified, but still radiation. Which means doctors carefully balance necessity versus exposure, especially for repeated imaging. And this is where the story becomes larger than medicine. Because healthcare systems constantly manage trade-offs. Speed versus detail. Cost versus precision. Access versus quality. Modern medicine is not magic. It's controlled compromise powered by technology. Then comes the other machine. The loud one. The expensive one. The machine that sounds like construction equipment trapped inside a tunnel. MRI, or magnetic resonance imaging. Unlike CT scans, MRIs do not use radiation. Instead, they use extremely powerful magnets and radio waves to generate detailed images of organs, tissues, nerves, and the brain. Which honestly sounds less like medicine and more like science fiction written by engineers. And the image quality can be extraordinary. Especially for soft tissue. Brains. Spinal cords. Ligaments. Tumors. Muscles. Nerves. This is why MRI scan technology became one of the most important tools in neurology and advanced diagnostics globally. But again, there's a trade-off. MRI scans usually take longer. They cost more. The machines are more expensive. Some patients feel claustrophobic inside them. And not everyone can safely undergo MRI imaging, especially patients with certain implanted metal devices. So despite public perception, MRI is not simply better, it's different. And modern healthcare systems spend enormous amounts of money deciding when each technology makes the most sense. That financial scale is enormous. Hospitals invest millions into imaging equipment, maintenance, software, technicians, radiologists, infrastructure, and data systems. Medical imaging became one of the largest industries inside global healthcare. Because modern medicine depends heavily on seeing problems early. And early detection.
The strange thing about MRI versus CT scan debates is that patients often think the machines compete with each other. In reality, hospitals use them like different tools in the same toolbox. A hammer is not better than a screwdriver. It depends what needs fixing. That logic quietly drives modern diagnostic medicine. If doctors suspect broken bones, internal bleeding, or emergency trauma, CT imaging may be preferred because of speed. If they need highly detailed images of the brain, nerves, muscles, or soft tissues, MRI imaging often becomes more useful. Different technologies. Different strengths. Different limitations. And that limitation part matters more than most people realize. Because modern healthcare conversations often treat technology like perfect truth machines. They are not. Scans assist diagnosis. They do not replace medical judgment completely. Two patients may show similar scans while experiencing very different outcomes. Human biology remains unpredictable enough to keep medicine humble. At the same time, artificial intelligence is beginning to transform diagnostic imaging globally. AI systems now help detect abnormalities, highlight suspicious patterns, and support radiologists reviewing thousands of scans daily. Which sounds exciting. And slightly unsettling. Because humanity is gradually teaching machines how to recognize disease. Not fully independently yet. But increasingly. And this introduces another complicated layer to modern healthcare. Data. Medical imaging systems generate enormous amounts of it. Hospitals now manage millions of digital scans requiring storage, cybersecurity protection, cloud infrastructure, and rapid access across healthcare networks. Medicine became deeply connected to information technology. A modern hospital increasingly resembles a combination of healthcare center and technology company. Meanwhile, healthcare costs continue rising globally, and advanced imaging contributes significantly to that pressure. MRI machines are expensive to purchase and maintain. CT scanners require sophisticated infrastructure and trained specialists. And this creates another uncomfortable global imbalance. In wealthier countries, advanced imaging may be widely available. In lower resource healthcare systems, access can remain limited. Again, geography influences diagnosis quality. The science exists. Access does not spread equally. And then there's the psychological side of medical imaging most people never discuss openly. Waiting for scan results. Few experiences create anxiety quite like hearing, "We found something unusual." Sometimes it's harmless. Sometimes it's serious. But during that waiting period, the human brain becomes remarkably creative at imagining worst-case scenarios. Ironically, one of medicine's greatest diagnostic achievements also created a new form of modern anxiety. People can now discover hidden health problems earlier than ever before. Which is scientifically valuable. Emotionally complicated. Meanwhile, social media continues flooding the internet with misleading health claims. Some people suddenly decide one scan is dangerous while another is perfectly safe, usually after watching a 3-minute video filmed by someone confidently speaking beside dramatic background music. Reality is less dramatic and far more nuanced. Doctors choose imaging tools based on symptoms, urgency, safety, medical history, and diagnostic goals. Not internet trends. And despite concerns about radiation exposure from repeated CT imaging, medical professionals carefully weigh risk versus benefit constantly. In emergencies, accurate diagnosis often matters far more than theoretical long-term imaging concerns. That's the uncomfortable math modern healthcare manages every day. Risk cannot always be eliminated. Only balanced intelligently. Still, perhaps the most fascinating part of the entire medical imaging technology story is how quickly humans normalize something once considered impossible. Machines capable of looking inside living bodies without surgery. Three-dimensional imaging. Digital reconstruction. Real-time diagnostics. A few generations ago this would sound miraculous. Today many patients mainly complain about waiting times and hospital parking. Humans adapt to technology.